We will now proceed with the Class 6 amalgam on tooth number 19. In this case, we're going to use the mesial preparation. In a similar fashion, we have evaluated the preparation. We've got a sense of the depth of preparation and the buccal lingual and the mesial distal extent. And we've also developed a visualization of the height of contour of this cusp when it's finally condensed and filled and burnished. We'd like to know that the restoration will reproduce the original cusp height and hopefully provide an occlusion that was present at the time that the cavity preparation was first made. We place our amalgam into the cavity preparation and use the condenser, again with downward strokes towards the pulpal floor and overlapping strokes, and lateral strokes to condense against the side walls of the cavity preparation. This is such a small preparation that it's only going to take 2 increments of amalgam to place. Now you'll notice in the condensing, I'm starting to see some wet or mercury-rich amalgam come to the surface. We don't want that to stay in place because that will be a weaker form of amalgam. The excess mercury needs to be vacuumed away from the patient's mouth. And we'll move that away and use the amalgam carrier and take our next and probably last increment into the cavity preparation. I'm going to condense in this case with a beaver tail burnisher with padding strokes and padding it in a way that we maintain the cusp tip height so that the final condensation is convex on the surface. And we've maintained the cusp tip. Sometimes a portion of the triangular ridge is reproduced in these Class 6 preparations, and so we're following the anatomy of the remaining natural tooth structure to develop the cusp tip and reproduce the general anatomy. I think I'd better stop work now because it looks like I'm to a point where we're ready for a minimal carving effort.